Hi, I'm Dr. Cameron from Jafari Acupuncture Clinic. If you're experiencing shooting pains in your buttocks or pain down the leg and you're having trouble sitting, standing, or walking for any period of time, you might be experiencing sciatica. Now in this video, I'm going to talk about the top 2 reasons for sciatica type pain, how you can figure out which one might be causing your situation, and how to address it. Sciatica is literally a pain in the butt, no pun intended. And so the quicker you can take the time to figure out the cause and address it, the sooner you can get back to walking, running, hiking, or whatever you want to do, and even just sit or stand comfortably. So what is sciatica? Sciatica is basically an irritation of the sciatic nerve. This nerve starts out as a series of nerves in your lower back and sacrum. So they come out from the spine, they go down the glutes, and then from there the nerve goes down the back of the leg to the back of the knee, and from there it just branches off. Now what we want to figure out is which one of these areas does your pain come from? And there's 2 main culprits. One is the lower back and the second one is the butt. So if you have some kind of nerve irritation or compression happening in your lower back, usually near the spine, that could cause your sciatica type pain. Another reason, again, is the butt, and over there, if there's tightness or irritation in the muscles affecting the nerve there, that can also create radiating pain down the leg. So what are the reasons or problems in the lower back that can create sciatica type pain? Well, let's remember the anatomy. The sciatic nerve originates from the spinal cord at the lumbar level. This means at the part of the vertebra, the spine that's in the lower back. When it exits the spinal cord, it has to travel through these holes. Okay, it's kind of like a tunnel. Now, if the integrity of those holes is compromised in any way, for example, if the hole narrows, this can cause compression of the nerve and therefore can create radiating pain into the butt or down the leg. So several different situations in which this can happen are, for example, if the vertebra, the disc between the vertebra starts to thin, the vertebra get closer together, that will narrow the hole. Another reason might be, we often see this in people who have a history of disc bulges or disc hernias. That can also compromise the size of that hole and make it more narrow. Another reason you might see it is if there's inflammation in the facet joints in the lower back. These joints, facet joints are basically just joints in your spine, okay? And if these joints get inflamed, they actually sit right next to where the nerve exits from the spinal cord. So inflammation in the joint can carry on over and negatively affect the nerves as well. The second problem area is the butt. Now, like we mentioned before, the sciatic nerve runs through the butt area, so it passes through a bunch of different glute muscles as it goes down the leg. Now, if there's any kind of tightness, spasming of your glute muscles, and this can be caused by a number of different things, exercising, sitting too much, all sorts of things. So if there's any compression, spasming, tightness of these muscles, this will press down on the nerve and obstruct its free flow. And when that happens, you're going to start getting radiating pain, oftentimes in the butt or even down all the way down the leg to the calf even. So how do you know if the pain is coming from the lower back or the buttocks? So next, I'm going to show you a few simple tests that we can try to figure out and see where this might be coming from. So first, let's see if it's coming from your lower back. If this is related to a disc-related issue, then bending forward is going to exaggerate that disc-related problem. And most of the time what that means is you're going to have more radiating or sciatica type pain when you bend forward in these types of situations. So to test this theory, we're going to do something called the slump test. Let's check it out. So first, go ahead and sit on a chair. You're going to put your arms behind your back, and then you're going to bend your neck, bring it towards the chest, and then bend forward like this. If this is aggravating your sciatica pain, it's very likely that your pain is stemming from disc-related issues. If the problem is stemming from a narrowing of the foramen or the hole through which the nerve exits, or if it's from a facet joint compression, usually extending the spine will start to aggravate the pain. So what we're going to do is we're just going to arch the back, just like this. You sit on the chair again and you'll begin to arch yourself backwards as far as you can. And if you start to feel like that pain going down the leg is getting worse, or the pain in the buttocks is getting more shooting, very likely we're dealing with facet joint compression or some type of stenosis. We need to investigate a little bit more, but we'll know that, okay, that's the area that we need to focus on. If forward and backwards bending are both negative, meaning they don't create extra pain, then perhaps your pain is not coming from the lower back and instead is stemming from the buttocks or glute muscles. To get an idea if this is the case, let's try this simple test. Go ahead and find the greater trochanter. That's the bony part of the hip on the side over here. And from there, just run your fingers backwards over here and just start pressing firmly. If you start to feel a lot of sensitivity or even pain when you press, especially when you compare it to the other side, then that might be a good cause to think that, okay, perhaps there is some tension, inflammation, or compression happening in the buttocks that's causing the sciatica pain. You can also, while sitting on a chair, put your leg on top of your knee, hug the knee, and bring it towards the opposite shoulder, just like this. What this is going to do is it's going to stretch the glute muscles right here. Now, if you're having compression in the glutes, this stretch is going to exacerbate that. And if it causes more tightness and compression, then definitely you're going to have more pain. So that's an easy way to tell if the tension or spasm in the glute muscles is contributing towards the sciatica pain. So now that you're aware of the root cause, you can begin a treatment plan that is efficient and provides maximum results. One of the reasons why people attain such amazing results with our system is that we don't just focus on the pain. We get rid of the pain while propelling you forward to doing those things that you weren't able to do previously. And this could be as simple as being able to sit comfortably while driving, or getting back to doing that 1 hour hike that you used to always do. So getting rid of pain is nice, but getting rid of pain while addressing the root imbalance is golden. Okay? I say this over and over again because what we're in the business of is not just slapping a bandage on your pain with a painkiller, muscle relaxer, or steroid injection. Those can help with the pain temporarily, but very often they don't address the root cause, and this is why weeks or months later you're going to have the same shooting pain going down the leg and you're wondering, why is this happening again? What we provide provides a sustainable, lasting result, so that when you go back to doing the things that you like to do, or just go back to moving as usual, you're not doing things that are just going to perpetuate another episode of sciatica down the line. So how do you know if this kind of program or system is a good fit for you? Well, there's a few kind of red flags, or I should say green flags, for this kind of situation. One is if painkillers aren't helping your pain anymore, or if you're just hesitant about taking painkillers for an undetermined amount of time. That's one. Number two is if you want to try more safe, less invasive therapies before moving on to more serious things like injections or even surgery. And the third reason B is you're a highly motivated individual, you're willing to do what it takes, and you just want to move on with your life. So thanks for listening. If you're interested in learning more or want to discuss your case a little bit, you can click below. There's a free consult request button there. It gives you a chance to come into our clinic or do a video call with us one-to-one. Just describe what's going on, what's your story, how's everything feeling, and at the same time it gives myself a chance to hear what's going on and make sure it's something we feel like we can help with. Thank you again. Have a good day. Bye-bye.